In this podcast, I am talking about female hairline lowering. I'm actually performing one today, and so I thought about this topic, and I haven't covered it yet in a podcast, I don't believe. So the idea here is that female hairline lowering, what I'm specifically referencing is typically someone that is born with a congenitally high forehead that wants it lowered. However, just putting hair transplants for a recession from either aggressive brow lifting, aggressive facelift surgeries, I don't actually remove any hair during a facelift, but the traditional facelifts that remove hair, that have hairs moved back, or this sort of loss with male pattern baldness that occurs in women called androgenic alopecia, can be another reason why the hairline is higher. There's two methods of doing female hairline advancement. One is surgical, where you actually make an incision across the area and then advancing the hairs forward. And the second method is a hair transplant. I vastly prefer the latter, and there's several reasons why. Let's just take the example for this patient this morning. So I was working on this patient. I saw this patient in consultation, and she has a relatively high forehead, not terribly high, just high enough that you could consider advancing it with a surgery, and I'll explain to you what that difference is. But there were a lot of factors that were, if you look subtly, was actually really would call for a transplant. One was the fact that she had a lot of miniaturization or thinning. And there's a lady that was 18 years old who was really not losing hair, but she just has a thinness across her temporal area. There's no way that a hairline advancement could actually fix the temporal area, and that was 2/3 the battle. So that was the problem. You can't actually lower that component. You can only lower the top. And all of that thin hair, I just reinforced with grafts. So I was able to go between those grafts and place hairs between her existing hairs to make everything match and balance out. So the other thing with this is that why would a hairline lowering the front be problematic? The reason is that when you lower the top, you can't lower the sides. And the temple is a huge component. So when you're doing surgical advancement, you can only move that middle third. Also, I find oftentimes if I've lowered a surgical hairline lowering, I have to go back and still add grafts because the scar is either visible, and I just did that actually on a lady last week, or the temple hasn't been properly addressed. So that is a real limitation when you're just doing a surgical advancement, not being able to manage all these thin areas, not being able to manage the sides. And the other component is not being able to advance it that far. A lady I was checking on last week had a really tight scalp. She would only be able to move it like a centimeter at most. So that's another thing, is I can actually move the hairline a lot farther with a transplant. And I get very high yields and growth after one session. The biggest negative of it clearly is you don't get instant result. You don't walk out with a full hairline. And then you've got to sort of cover it with bangs until those hairs suitably grow in over a period of 5 or 6 months. Oftentimes my female patients, need about 7 to 8 months to be fully satisfied. So that's a big negative, obviously. To me, waiting that 7 or 8 months compared to the fact that there's so many advantages for a transplant surgery. And again, when you come in, I'll talk to you about the pros and cons of each one. But those are the reasons why the vast majority of my cases are female hair transplants over surgical advancement. And I really believe that oftentimes offers the best solutions for most females.